Kia ora team, so today looking at Anatomy 7 and looking at agonist versus antagonist muscle pairs. By the end of this video you need to know that muscles always work in agonist/antagonist pairs. You need to know what an agonistic muscle's job is, and you need to know what an antagonistic muscle's job is. Okay, let's get started. So muscles always work in pairs. Muscles can only pull, they cannot push, okay? So it's pretty straightforward. They can pull, but they cannot push. So while one muscle pulls on a bone to make it move, the other relaxes. If they were both pulling at the same time, no movement would happen because they're both opposing each other, okay? So one relaxes while the other one pulls. The muscle that relaxes in a movement is the antagonist. So the one that sort of relaxes, chills out, does nothing is called the antagonist. The one that does the pulling and does all the work is called the agonist. Pretty straightforward. We're going to look at that a little bit more in a sec. So when one muscle pulls one way, the other muscle must pull the other way to move the joint back. So if I bend my elbow, okay, to move it back to straighten it out, the opposite muscle must then pull the other way. Agonist versus antagonist. Looking at the elbow now. So flexion and extension. So you can see here, flexion, okay, flexion again, and extension. So the agonist for flexion is the bicep, because the bicep is pulling the forearm up towards itself, okay, closing the joint or bending the joint. The antagonist is the tricep on the back of the arm. That's relaxing and allowing the bicep to pull the forearm up. If they both pulled at the same time, the forearm wouldn't go anywhere. Extension, okay, so that's the arm opening up. So the tricep pulls on the forearm, pulling it down and opening the joint up. And the antagonist is the bicep. So the bicep relaxes and allows the tricep to pull the arm down. So here, the tricep's pulling it down and the bicep is relaxing. Okay, so we're just going to run through the knee nice and quickly. So the movements of the knee are flexion and extension. So flexion is bending or closing the joint. The agonist during flexion are the hamstrings on the back of the femur. They pull the lower leg up to bend the knee joint. And the antagonists are the quadriceps on the front of the femur, and they relax to allow the hamstrings to pull and flexion to happen. During extension, we have straightening or opening of the joint, and the agonist is the quadriceps on the front of the tibia, which pulls on the lower leg and it pulls it down to straighten the knee joint. The antagonist is the hamstrings on the back of the femur, which relax to allow the flexion to happen. So you can see that the quadriceps and the hamstrings work in pairs here. So during flexion, the hamstrings are doing the work and the quadriceps are relaxing. And during extension, the quadriceps are doing the work and the hamstrings are relaxing. So we're just going to have a quick look at that now. So we can see here that we've got the quadriceps on the front here, and we're about to look at some extension, some knee extension. So as the knee comes down, the quadriceps, so these muscles here in the front, they are extending, they're shortening, they're pulling on the tibia at the front there and pulling it down. Okay, and the hamstrings at the back are relaxing. And here we're looking at the back of the leg, and we're looking at knee flexion. So from there coming up, that's flexion happening there, and we can see that these muscles here, the hamstrings, they are the ones doing the work. They're pulling this joint, this lower leg here, up towards the hamstrings, closing the joint or bending the joint, acting as flexion, okay? And the quads on the front here they relax and allow that to happen. Okay, so let's go through that again. The hamstrings pull that up whilst the quads relax. So just one more example, which is the hip joint. Okay, so hip extension and flexion. So again, flexion is bending or closing the joint, and extension is straightening or opening the joint. So the agonist in hip flexion are the hip flexors and quadriceps. Okay, so there's two groups of muscles acting as agonists there, so two groups of muscles doing the work. And then we have the gluteus maximus and hamstrings relaxing. So that means they're the antagonist pair in that movement. Then during extension, we switch it round. So the agonist, the one that's doing the work, becomes the gluteus maximus and the hamstrings. Okay, so they're pulling the femur down to straighten the hip joint. And then we've got the antagonist, which are the hip flexors and quadriceps, which relax to allow the extension to happen. Okay, so we're just going to have a quick look at that now. So here we can have the leg again, and this is the hip joint here. And if I just roll this along a bit, you can see that that's hip flexion. Alrighty, so the hip flexors in here, they're shortening and they're doing the work. Okay, so the hip flexors and also the quadriceps, these muscles, they are shortening and they're doing the work, whilst the gluteus maximus on the back here and the hamstrings are relaxing. So we're just looking at the back of the leg now, and we'll just roll this along here. So that's hip extension. We're extending the hip. Okay, so we're bending the hip, we're straightening the hip. Okay, so hip extension, the gluteus maximus, these ones here, okay, big ones there, and the hamstrings here, they're now doing the work, whilst the quadriceps on the front are relaxing and allowing these muscles here to pull the leg up, or to pull the hip joint up. Awesome, thanks team. So make sure you complete the Google form online before your next class. It's a bit of a longer video today, but lots of important stuff you need to know there. So cheers, have a good one.